we have Erica Albritton, who is the Vice President of Operations at HCA Florida Oak Hill Hospital in Brooksville, Florida. She will discuss how her hospital system successfully integrated the Guardian technology and program through a billing and reimbursement overview. Erica, welcome.
Hey, thanks for having me. All right, let's go to the first slide. And so one thing we're going to cover is really how we set up the structure around this new technology so that we could be successful with patient outcomes and financial outcomes as well. And that's very important when bringing in a new technology into a service line and hospital. So our physician champion came to us and said, I want to be the first in North Texas. I was in Texas at the time when we did this, to implant this novel device with artificial intelligence and everything that it can do for his patients. So that was the pillar that we built around from there. I was in the director position at the time and was the administrative leadership champion. And my role was really to ensure that obviously our cath lab staff was trained and appropriately understood what we were doing, made sure that our billing revenue integrity department had all of the tools they needed in order to bill appropriately, and kind of connected the Vertex local team, Tom and his team, to help us all pull everything together between the physician office and the hospital. And without the Vertex local team, we would not have been able to do that successfully. We really got ahead of the billing and issues with this new device by having open meetings with our revenue integrity department, but also with the Pinnacle Health Group. And so I'm going to explain more what the Pinnacle Health Group did for our reimbursement. So this Vertex support with the Pinnacle Health Group was integral. It really, on the front end, ensured that we had patient authorization before we scheduled these patients. And so how we did that is Tom, the local Vertex representative for us, he partnered with the physician office, and that's going to be really important as you integrate this into your system. He partnered with them, came in on a weekly basis, and began the patient funnel. He partnered with the PA of our physician champion. She would take the iPad, show the videos of the Guardian system to the patients who qualified. And if they were interested, Tom would then help them get the patient into the Pinnacle Health Group portal. And then they would start the process. Once they had their authorization, we would get them on the schedule at the hospital. So that was the front end part of the billing. And we did not have a single issue with the cases that we did on getting reimbursement once they had that pre-authorization. We had one managed Medicare. That was our very first patient we did. They even helped us on the back end when we had one question on the billing because our physician decided he wanted to admit that patient for obs overnight, and Medicare wanted us to have it as an inpatient. And so they came through. Pinnacle saw the patient the whole way through and ensured that account closed out and was paid. And so that was very helpful. And again, between Pinnacle and the Vertex local representative we ensured that was successful. And so the resources that they provide are very important in being successful here. Extensive in-services for all of our departments, from the ER, the cath lab, and our pre and post-op unit, as well as working with our revenue integrity departments, providing the implant support. They show up the day of. They do bring yummy food for our team so that they can have breakfast in the morning, and you know how the cath lab loves to eat. And they provide the implant support as well as the follow-up support. So if those devices are alarming, I never heard one time that they had to wait for the Vertex team to show up to the office to help with the patient. So here are the reimbursement codes that we were successful with the pool of patients we kind of trialed at first. We used the hospital-specific APC payment of 0525T and the transitional pass-through payment for C1833. And again, we did not have a single issue other than that one little Medicare. We just had to make sure the patient was on inpatient status when we admitted them. And then this will kind of show you the commercial payers were really good and they were very consistent. We had a little bit of a mixture of, we had Blue Cross Blue Shield. I want to say we had a Cigna and maybe another one, but for sure Blue Cross and Blue Shield was one of our main ones that we had. And you can see that they did a payment of $72,908, and we had a contribution margin of $62,800 there for the hospital. The Medicare paid out much like a pacemaker. It was about a $16,000 payment when we had a contribution margin of about $6,000 there. So about the same as a pacemaker that we usually see. It's very important, I think, that when you're setting these programs up you're just kind of paying attention to that payer mix so that you can ensure, I mean, the patient outcomes, as you heard the physicians before me speak, they really speak for themselves, and we really saw that. So that wasn't a concern once we got into this, but really ensuring that we're not taking a hit on the financial impact for the hospital and for the physicians was important. So making sure you're paying attention to that as you kind of start the program up, I think that was very vital to our success, because I've been gone now for about 3 months, and the program has been going for about 1.5 years since we did our first Guardian. It's still doing very successful work over there. So this is not my this is not my expertise at all. However, we need to mention this. The physicians receive the professional fee reimbursement. So it's very important to partner with your verdict support system, support locally, to ensure that you guys are getting the reimbursement that you can on the physician follow-up visits, as well as on your implants. You can see here on the slide that you get paid for those follow-up visits. And so partner with your local team to ensure that you're billing appropriately with these CPT codes and getting paid to do the great care that you're doing.
Thanks, Erica. That's a really great overview. I know that just having something that's FDA approved does not mean we can get it in our hands to help our patients. And there's a lot of work that has to go into meeting with value committees and setting up to show the financial aspects of this, but it certainly is beneficial to the hospitals. I'll also add, personally, from the perspective of someone who implants in an ambulatory surgery center setting, that we generally receive reimbursement at about 60% of what the hospitals receive, and we are doing well with that.